Okay, last chapter, chapter 14 of the next step coding book. I know you're tired of me doing this. This is anesthesia. Remember when you're coding anesthesia, from a code standpoint, it's very general codes. We're used to the whole rest of the CPT manual being very, very, very specific. Your anesthesia codes are not. So that's good. But with your anesthesia codes, we have modifiers for nurse anesthetist and for anesthesiologist. We have qualifying circumstances, and we have our physical status modifiers. If you have not written the cheats in from the CPT anesthesia video, you need to go back and watch that and get your cheats in, because you're going to want to have them when you take your board. Here is just concise, wordy stuff about anesthesia. Does a pretty good job. Talks a little bit more about your physical status modifiers, your base units. Remember to write your anesthesia. I'm going to try to get that to quit. Remember to write your anesthesia formula in your CPT manual so that you have it. You'll probably have one question, but these are easy questions. If you don't have the information, they're impossible. If you do have the information, they're easy questions to have. They're not just like a coding question. So I'm trying to help you out as much as I can with what I know will be on there. Then starting about your concurrent care modifiers, these are the modifiers that we write as cheats in our book. This CPT manual that I have is not my normal one, but I am going to, so I don't have any of the notes written in it either. I'm breaking my own rules. But I am going to show you where I would write them. Here's the beginning of the anesthesia. You have this entire page. That's the page I would use. Get your, or this is made just a little different. You could do them here on the page with your physical status modifiers and your qualifying circumstances. You could do it down here, but make sure somewhere in here you have your formula, you have your different modifiers, your Q modifiers that I'm talking about. Make sure they're in there. You will want them, I promise. Here are the different modifiers I'm talking about. There's just a couple of number modifiers that are in the front of your CPT book. Different positioning. This helps with your concurrency when your physician, MDA is your anesthesiologist, CRNA is your nurse anesthetist, and this kind of breaks down some of these modifiers, makes it a little bit easier to get your mind around, or your head around. Your qualifying circumstances. Remember that if your code, your anesthesia code, takes into account the age of the patient, you do not use your qualifying circumstances. And there's probably going to be a parenthesis that tells you not to. We learned that last week on the partial mock board. Anesthesia time, when it starts and when it ends, you will have a question about that. Don't worry too much about calculating. Just kind of have a basic grasp. If I were gonna just get a grasp, I would assume that every base unit is 15 minutes. So there's 4 base units in an hour. And just go with that. That may be a little different depending on where you work or what geographical area you work in. But that would be my rule of thumb, at least for learning here and for the purpose of the board. Some specific areas, your moderate sedation, conscious sedation. This is just a idea of the different base units within a code. You can see some have 10, some have 5, some have 3, you know, and you would, if you're coding for an anesthesiologist or anesthesia in a hospital, you would have access to that. So, okay, so here we go. Case 14-1. I wouldn't get into any diagnoses in here. This chapter's not about diagnosing, it's about assigning the correct anesthesia codes. So this entire book, we've been looking at post-op diagnoses. That might help you pinpoint a body part, but don't read it as in trying to get a diagnosis code for it, because we're not going to do any ICD-10 in this chapter. It is straight anesthesia. So for this particular anesthesia, they're doing a muscle flap and a split thickness skin graft. They have an ulcer of the lower extremity, so that gives you your body part. Remember, these are very general codes. All of your MDA, your doctor anesthesiologist, and your CRNA information will be in the black writing, so that will help you determine how to do your modifiers. This one had an anesthesiologist and had a nurse anesthetist, so you'll have the same code twice, and then you'll have different modifiers. AA would go on the anesthesiologist code, and your QZ would go on the nurse anesthetist code. This particular patient is 76, so she's over 70, so she'll need a qualifying circumstance add-on code. And this patient also has severe hypertension, so she's a P3 status, physical status modifier. I'm not going to get into too much depth in any of these, but that's just how I just walk through this. Is all the information you need. You just plug it in. So 14.2, perirectal fistula is what this patient has. That gives you your body part. So all you have to do is determine what the physical status is of the patient, and then what modifiers. Was there just an anesthesiologist, or was there both? There was both. The anesthesiologist was medically directing 4 concurrent cases. So get the right modifiers, and then you'll have, this is a normal healthy patient, so you'll have your physical status modifier. 14.3, there was no medical direction here, so you just have one code for the nurse anesthetist. This was surgery on the back. It's a fusion. Nope, that is not true. It is a fusion, but it's on the foot, subtalar. I saw fusion and assumed the back, so don't do what I just did. So make sure you know your body part to be able to get it. If they don't tell you anything about the status, the physical status of the patient, assume they're a P1. 14.4, this is a septoplasty and tonsillectomy, so that's our body part. This one, because you have a mouth code and a nose code, there are 2 different anesthesia codes you could use, so it won't matter which one you use. You wouldn't use both, because you would be expecting the insurance company to pay this physician or this anesthesiologist for both of those codes for the same procedure. So you can just pick whether it's nose or mouth. It's up to you. 14.5. This is a right carotid body tumor. This particular patient, I think the answers had an arterial stick. I read and read and read this thing, and I could not see where the anesthesiologist performed any kind of art line. No stick in here. So if you find it, let me know. I didn't find it. Your answers are going to have it listed, but I didn't see it. So there you go. You do have both a anesthesiologist and a nurse anesthetist, and this patient is older. They're 82, so keep that keep that in mind. 14.6. This is a circumcision, easy peasy. Just read your specifics here. 14.7, normal healthy patient. This is a hysteroscopy for a D&C. It's done by the anesthesiologist. 14.8 is a craniotomy. This was done under emergency circumstances, so that is a qualifying circumstance. Extra code, this is done by the anesthesiologist. I would say this patient's probably a P4 because it's being done under emergent circumstances, but you can tell me if you disagree. 14.9, this is nasolacrimal duct probing. That gives you what your body part is. There is both a nurse anesthetist and an anesthesiologist. 14.10, hemithoracic cavity packing. This is a anesthesiologist and a nurse anesthetist, and a patient has well-controlled diabetes. Your well-controlled stuff's probably going to be P2. Your not well-controlled or severe is going to be your P3s or worse. 14.11, this is a lesion of the left lower extremity. That gives you your body part. Patient was healthy before this. 14.12, breast biopsy with needle localization. They did use MAC, the monitored anesthesia, so you will need an extra modifier for that. The CRNA performed this independently, and patient was otherwise healthy. 14.13, this is an op report, ulcer and cholecystitis. So 14.14, this is a hemicolectomy. So they're taking out part of the colon. This does have a anesthesiologist and a nurse anesthetist. Gives you some specifics here. They have well-controlled hypertension. 14B is an epidural catheter placement. This would be for post-op pain management. So it's kind of broken up funny. Here's the hemicolectomy. Here is the catheter, the epidural catheter placement, which isn't an anesthesia code. You got to go to your nervous system for that. I would use a 59 modifier to make sure that it flags in the claim system so that everybody, the insurance company, knows that this was separate, identifiable, and needs to be paid. It was for a specific reason. Then your 14C is the daily management of this catheter, which there's a specific anesthesia code for that. 14.15, tendon repair. This had a anesthesiologist and a nurse anesthetist work on that right knee. 16 is an arthroplasty on the knee. 14.17, this is a closed reduction percutaneous pin fixation on the metacarpal for a metacarpal fracture, so that's on the hand, so that's your body part. 14.18, debridement, arthroscopy or arthroscopic debridement of the shoulder. This patient has severe systemic disease. We don't know exactly what it is, but they tell us that, so that would determine your physical status modifier. 14.19, again, we have entropion and extropion. Doesn't seem like we can get rid of that the last couple of weeks. They do, no, never mind. 14.20, hysterectomy. This is a total abdominal hysterectomy. Patient was healthy beforehand. 14.21 is a C-section. This is done by the anesthesiologist. 14.22, another C-section, and they're doing a tubal ligation at the same time. And this patient, they are insulin-dependent diabetic with diabetic nephropathy. She desires sterilization. I think she's not wanting any more kids because of all of her diabetic complications. I would almost say she's a P3. She's got, this is a, not only is she insulin dependent, but she's got some kidney involvement. I would call her physical status modifier a 3. And then just some information about subdural hematomas, and then we have our audit cases. And then this is that audit form that I had posted online that you guys have all kind of been playing with. And that's it. You have whipped this book.